Hello, I'm Dr. Barry Pakes, York Region's Medical Officer of Health. On that note, some just released Ontario data confirms that the booster dose is 95% effective at preventing hospital admissions in Ontario, a substantial increase over two-dose effectiveness. If you thought that perhaps you don't need a booster, you do. Our recent modeling shows that our booster campaign and the 50% of York Region residents that have been boosted have prevented by half the number of admissions to hospital per day, with over 500 admissions prevented total, 60 ICU admissions, and over 200 deaths prevented. Booster doses for each and every one of us is crucial. We know this has been challenging for all of us, people and businesses included. So the beginning of the reopening plan is an encouraging sign, with additional capacity limits to be reviewed and continued as of February 21st if indicators keep moving in the right direction. But this all depends on you and our booster dose campaign. Of course, children are included as well, and children's coverage is critically important. I'm happy to say that we now have Pfizer back in all of our clinics for booster doses. The province has received additional Pfizer vaccine doses and will be back to administering both Pfizer and Moderna in York Region clinics shortly. In more exciting news, we are now accepting walk-ins for all booster doses as well. This is a big change to make it more convenient for you to either walk in or make an appointment. For anyone who wants COVID to be over, I can't express the urgency enough to get your booster dose by walking into any of our York Region clinics for your first, second, or booster doses. You can also book an appointment at york.ca/COVID-19 vaccine or by calling Access York at 1-877-464-9675. Lastly, on the vaccine front, the National Advisory Committee on Immunization, or NACI, has recommended a booster dose for adolescents aged 12 to 17, but only for those with specific medical conditions or who live in congregate settings or those from high-risk or marginalized groups. We look forward to sharing the details of this long-awaited change shortly. Unfortunately, all 12 to 17-year-olds are not yet eligible, despite us knowing that many parents are very enthusiastic for this change. There are many ways that we are currently tracking COVID-19 and the pandemic, and we have recently updated our interactive dashboard at york.ca/COVID-19. We now have an easy-to-view and current hospitalization and ICU data, and the dashboard continues to include wastewater information and our vaccine progress in York Region. When looking at our wastewater data, cases in York Region seem to have stabilized and are decreasing, so I'm optimistic for the waning of this surge that we are all hoping for. Finally, I want to remind you to be vigilant and think of others in the community who are most vulnerable. Omicron transmission is still very high, and we need to remain cautious. If you are feeling any COVID-19 symptoms, assume you are positive, notify your family and close contacts, and isolate immediately. If you have tested positive with a rapid antigen test, please also take part in our anonymous survey at york.ca/COVID-19 positive. Here you'll also find next steps and information on how you can protect yourself and close contacts. Let's do our best as a community to stay safe, be healthy, and get vaccinated.